Hello, everyone. Welcome to today's episode. And what I'm talking about today is performance indicators. So this is quite useful for those that are studying and working in health and social care. Okay, what these are, they're slightly different to professional standards because what performance indicators are, they're there as a guideline to show you what good practice is. It doesn't matter what level you work at. You could be a nurse, doctor, carer, anyone within the health and social care industry. It covers everybody, and most of these are actually titled to who they apply to, including the codes of conduct and other guidelines that are out there. So I will explain the purpose of these guidelines, and I'll discuss three different organizations which I've got no link to. There's no sponsorship deal, and I do not own any copyrights to these organizations. All I just do is I use them as some of the main organizations that I used in the UK in the healthcare system as per performance indicators. Right, so performance indicators are there to guide you, like I said, as a professional, so that you know that you're providing the best quality care that you can, or the best quality service that you can within your industry, mainly in the health and social care. So the three organizations that I'll discuss today are National Institute for Health and Care Excellence, which is also known as NICE. I'll also discuss Care Quality Commission, or CQC, as well as Skills for Care. So I'll start with Skills for Care, which is codes of conduct. What codes of conduct are, they're there as they run alongside CQCs. I think you know that CQC are the regulators and monitors of all health and social care organizations within the UK. So what these Skills for Care codes of conduct does is it runs alongside to guide you into what is regarded as best practice. So within this best practice, it looks at things like you need to uphold patient or service user dignity and privacy. You also have to be equal. So when you plan activities, for example, they have to be inclusive, and you have to embrace diversity and equality. You have to collaborate with colleagues to improve or promote the health and well-being of your service users, and so on. So that's what the codes of conduct does. And the codes of conduct, once you follow that, it forms your professional standards. You know what standards you're expected to work at. You cannot just work in this industry and not know what's expected of you. It also helps service users to understand what's to be expected from you as their service provider. And I think in most organizations, such as the NHS, as a patient, you can actually request to see the codes of conduct that apply to the people that are serving you. Okay, so that's it for the Skills for Care. The next one that I'll discuss is the CQC, and they have got what is called a CLOE framework. A CLOE framework looks at certain standards that when they come to monitor in any organization, they mark against these. And if anyone's familiar within education, within our schools, they use Ofsted to see if the quality of education being delivered and other benchmarks that they set are being met. So it's the same in health and social care, and it's the CQC that does it. So by making the CLOE framework, they're making you aware of what it is that they're coming out to look out for when they come to monitor you. Okay, so these include safety, compassion, and so on. And what you tend to do then is you've got what are called fundamental standards and essential standards. And within those, it will tell you exactly what it is that you need to do in practice in order to meet those standards. And if you were somebody that's familiar with that, and you own, let's say you own a care home, or you are managing a ward, and you are sort of like designing your day-to-day activities or your day-to-day work alongside these frameworks, when you hear that the CQC is coming, there's no panic, because all they're looking for is what you do anyway. So that's what it guides you to. And if you're studying, this is how you can put this into an essay to say that the reason why we have performance indicators is they are there to guide us so that we can then comply with their regulations or with the laws, as well as provide good quality care. Okay, and the last one that I'll discuss is NICE, or National Institute for Health Care Excellence. Okay, what they have done is they have made a document which applies now to all adult social carers, including family carers, okay, as well as local authorities, as well as service providers, which could be employers of people that work in health and social care, and also the assessors of people with disability that with disabilities that look at whether you've got any needs that needs to be met at local authority level. Now, what that does is it allows you to understand that, you know, being a carer or taking care of someone or working in the industry can have its toll on your health and well-being. That could be mental or physical health. Okay, so what they do is they come in with this document that shows you that your employer should be able to understand that, and in order for you to be able to progress and work within those, you need to be able to access psychological help, you need to be able to access debriefs and so on. Let's say you work with people with challenging behaviors and it gets violent, you know, you need to be able to have a service where your own psychological needs are met and you're reassured and you know that you're doing the right thing, as well as access training, because within care, people do administer medication, they do manual moving and handling, they do personal care and all sorts of activities that require you to be trained and to be working up to a required standard, because without training alongside those lines, you could be breaching the likes of safeguarding, which could end up incriminating you, and a lot of people have ended up in prison. If anyone is aware of the case study of the Winterbourne View scandal that was done by BBC Panorama, it will tell you exactly what safeguarding breaching can lead up to. It led up to a care home being closed and everyone being moved around, and a few people actually going to prison because of safeguarding breaches. So that's why we have these guidelines within the structures of health and social care. Okay, so that's it for today's topic, and I hope you found it useful. Like I said, comment, like, share, and subscribe, because once you do comment, you can actually ask me what topics you'd like me to cover, and then I will try my best to explain it in summary. So this is summary. Obviously, if you're doing an assignment, you have to reference it, and you can actually use the 3 documents. Go online, you can find them. They're available to everyone. Like I said, you know, this is not a sponsorship deal. This is what I use in my teaching. This is what my students have been using, and they've been asking questions, and these videos also help my students to understand and revisit maybe what would have discussed in the lessons. So thank you so much again for watching yet another episode, and I will be bringing more topics, but I also need your guidance to tell me what topics you want me to discuss in line with this. So thank you very much, and I will see you next time. Bye.